Endoscopic management of high esophageal stricture, otherwise known as post-cricoid esophageal stricture. A 60-year-old man was referred for management of a high esophageal stricture following radiation for head and neck cancer. He took an hour to drink a cup of coffee. A number of issues need to be addressed. These strictures should be managed under fluoroscopic control with the use of a slim endoscope. Patients should be counseled about the need for multiple sessions. Nutrition should be addressed with the insertion of a PEG tube. Neck exercises and chewing gum should be encouraged. First dilation session. This procedure was undertaken under conscious sedation using a slim endoscope. After passing through the upper esophageal sphincter in the immediate postcricoid region, a very tight esophageal stricture with a very narrow orifice is seen. This is about the size of about 2 to 3 millimeters. A jaguar is passed and the endoscope was removed. Subsequently, a CRE balloon catheter starting at 6 millimeters in size was inserted over the guide wire, and the endoscope was passed alongside to visualize controlled dilatation of the postcricoid esophageal stricture under both endoscopic control and fluoroscopic control. As you can see here, a tear of the mucous stricture was seen with a flap of tissue in the lower quadrant, lower half of the field. After the dilatation and a successful tear of the upper esophageal stricture, the balloon was removed, and with the gentle pressure, the slim endoscope was passed through the stricture into the upper esophagus. As you can see here, the scope has gone beyond the strictured area, and as the scope is being withdrawn, one would notice the tracheoesophageal processes as a white collar button on the inside in the upper esophagus. Second dilation session was done after a couple of weeks. It's important to notice that guide wire insertion in postcricoidal strictures is tricky. It's important to do it under close observation and fluoroscopic control. Again, the stricture was dilated with a CRE balloon, this time from 8 to 10 millimeters in size, and using the balloon as a guide, the scope was pushed out easy entry into the upper sphincter. Third dilation session was done after 2 weeks. Here, the scope going behind the dilated balloon catheter is being shown. The balloon catheter, once insufflated to the maximum, can act like a Savary dilator, and you could push the dilating balloon catheter in front of the endoscope, and the scope could follow along with it. Dilation session 4 after 2 weeks. As you can see here, it's important to recognize that in patients with postcricoid esophageal stricture, they may have multiple rings, as you can see, and these rings needs to be ruptured. Dilation session 5. After this session, all the membranous rings were successfully ruptured with a linear tear that would be obvious as the scope is withdrawn, with excellent recanalization of the lumen. This has resulted in a significant improvement of the patient's condition, and the patient was able to swallow most foods, and the PEG tube was removed.